are live in 5, 4, 3, 2, 1. We are live now.
Yes, welcome to the first session of the active learning sessions of Pediatric Orthopedic. That's a new concept, and we expect that probably this will be very helpful to you in developing your thinking process. So in these sessions, we are not going to focus only on pediatric orthopedics, but the thinking as a large is aim of this. To give you the overview of today's session, in the first 20 to 30 minutes, we are going to understand what is we mean by active learning. And after that, we will go to the main topic, that is cerebral palsy management. Again, most of you are pediatric orthopedic fellows, surgeons, so you will be looking for the tips of surgical cases, how to operate. But please understand that this is not only about surgery, it is more about the indications and understanding why we are doing this. So first of all, I am passing on a baton. I am really fortunate to have a great mentors in my life, great teachers who have really shared their knowledge, their wisdom, their experience with me. And because of that, I am able to develop my thinking process. I'm very happy that two of my teachers, Professor Benjamin Joseph and Professor Freeman Miller, have agreed and they are participating in this session. So this is going to be a 3 generation, my teacher, me, and the students. So this is what I consider that I'm passing the baton. Now, a brief introduction about Professor Benjamin Joseph. I'm sure that all of you know him, but Professor Benjamin Joseph is the man to whom everyone, or even outside India, is well respected. He was a professor of pediatric orthopedic in Kasturba Medical College, Manipal, and he was the first one to start pediatric orthopedic as a individual specialty in India. He has contributed immensely in the literature, but in last 10 years, he has published 3 books which are very important for all of us. The first is a pediatric orthopedic, a system of decision making, in which he has described how to make decisions for a pediatric orthopedic condition. Then 5 or 7 years back, he published a second book, that's a pediatric orthopedic diagnosis, and that is about making a correct diagnosis by asking right questions. Only last month, or I would say last week, he published another book, that's Essential Pediatric Orthopedic Decision Making, a case-based approach. And in that, he has taken the most common conditions which we come across the practice and how to go ahead for the decision making in for those cases. So I strongly recommend you all these 3 books to develop your thinking process. There is another legend with us, Professor Freeman Miller. I would consider him as an encyclopedia of cerebral palsy. And again, he has contributed a lot in the literature. I'm sure that there are more than 100 articles in the index journal. But over and above that, he has the 3 books. The first is, again, a very widely read book, The Cerebral Palsy. Now it is more than 3,000 pages. And last year, there was a second edition of that book. So again, I recommend you to read this book to understand minute details about cerebral palsy. The second book he published is for the physiotherapist, and that is Physical Therapy of Cerebral Palsy. It's mainly for non-pediatric orthopedic specialty to understand cerebral palsy. In addition to the books for the professional, he has also published a book for the caregivers, and that is written by Freeman and Stephen Bacharge. Again, that's for the parents and the family member. Again, that book is very popular and it's in the 3rd edition. Now, introduction to these sessions. Most of us, I can't say 100%, but most of us have a conventional teaching method in which the teacher has tried to give us information. So as shown in this picture, the mother is feeding the child. The same thing happens in education, and we can call it a jug to mug. The person who is knowing more gives some information to the younger generation. Some people call it kettle to cup. Ultimately, that's the same concept. But I consider that as a passive learning. When you are giving them information, yes, it's a very quick way of passing the information, but that's not the good way. And why it is not good way, that I will tell you in a minute. These sessions are basically based on a very famous quote that if you give a person a fish, you feed him for a day. But if you teach him how to fish, then you feed him for lifetime. And this is what we are going to do in these sessions. Let me tell you a real story. I heard about active learning in 1978 when I was in a 10th grade in a school. One alumni from a very famous business institute, Indian Institute of Management, Ahmedabad, which is considered to be similar to Harvard Business School. He was an alumni of our school, and he came to our school to tell us something about what is IIMA, because at that point we had a very high respect, or even today we had a high respect for IIMA. So the aim of his visit was to give us some idea about IIMA. So our principal, he asked a very simple question that what makes IIMA very different from the other business school. And he said that the teaching method at IIMA is very different. And then he gave us one example, and he actually showed us an exercise, and that I'm going to share with you because that's an exercise even after 45 years, I remember. He said that at IIMA, we don't have lectures. Our professor gives us a problem and we have to think on problem. He said that on the first day, we were given a problem about one farmer. This is about a farmer who has a farm with a 500 square meter in one remote area of India. This farm, he showed us the design, like suppose this is a farm which is on the one side of the road, and there is a bore. Bore is like the pump from where the farm is getting a water. The farm has to rely on either bore or a rainwater. And he said that the farmer had 2 sons and 1 daughter. Now the farmer wants to distribute this between the 2 sons and a daughter. And how can you divide this farm into 3 equal portions? So this was an exercise which he gave. We thought about this simple problem, and we came out with 20 options in 15 minutes. And he said that when this problem was given to us in IIM on the first day, we came out with 140 solutions. So that's basically the difference between the teaching at IIM and the conventional teaching. And we are going to follow the same procedure. So he says that professors at IIMA believes that students' mind is not a vessel to be filled, but a fire to be ignited. And any good teacher will be, as shown in this, is going to ignite a fire in the mind of student. And we are going to carry out the same process or attempting the same one in these sessions. So something basics about active learning. There will be common steps. The first, we will generate questions. We will put forward a problem in front of you, and then we will generate questions. Then we will give a homework so that you have to think about the question and try to find out the information on that. So we will also guide you about like from where you can find the information. The next thing which you will do is you will find out the answers, and then you will share your answers with the group. So this is going to be an active learning where you will be getting some homework and you have to carry out and then present to us in the next sessions. What are the advantages? The advantages are many, and the most important thing is like it creates a sound base of understanding. And for that, I always give an example. There are two famous buildings in the world. The first one is a leaning tower of Pisa, which is gradually leaning. And the second one is even higher than that, is a Burj Khalifa, which stand erect and upright. What is the difference? The difference between the two is the foundation. The foundation of this building is so strong that it can remain upright, erect for many years together. The second advantage is like you will remember it for longer time. I gave you one example, the case which I discussed when I was in the 10th grade, that is 45 years before, but still it's very clear in my mind. And the same thing is going to happen with you also. The process which you will learn in this exercise or these sessions will going to help you to solve other problems in the life. It may be a social problem, it may be other financial problem, but it's the thinking process is going to remain same. In addition to that, you will be developing a skill like how to search for the information, how to focus your search to find out the answer, to understand those information, analyze the information, because now we have a easy availability of information, but the important thing is to understand and analyze those information is the crucial skill. Then you will be able to summarize and express those information to the group. That is going to be the next thing, and how to present it so that the other party can understand it better. So all these skill you will be learning during these sessions. There are few drawbacks also. It's a slow process and it requires an active participation. So let me tell you, without your active participation, we will not going to learn a lot. So your active participation is very important. So at this stage, I would like to pause for a minute and would like to have an opinion of Freeman and then Professor Benjamin about active learning, because they are a great teacher and they have taught many pediatric orthopedic surgeons across the world. So what are their opinion about or feedback about this active learning process? Yeah, Freeman first, and after that we will have opinion of
Yes, I think this is absolutely successful over one's long career, because for one, especially in pediatric orthopedics, you often will have cases that don't conform to the typical, and then you have to think beyond just a recipe for treatment, but you have to try to understand the principles, to ask the questions about the expected outcome. And it is absolutely crucial to sort of develop this concept of trying to analyze the problem, dissect it, and then apply the knowledge which you have gained prior. An important part of active learning is you do need a foundation of knowledge to which on which you can base both the proper questions and then dissect down the appropriate segments that you can apply to try to come up with a solution. And I think it's a very good, it's especially good for case-based learning.
Good. And Benjamin, what is your opinion about active learning?
I think it's an excellent way of trying to learn. Didactic lectures have got some load, but I think interactive sessions where you can have a Socratic method of education is probably wonderful.
Exactly. So what you said is like this is going to be a Socratic method, and we will be asking more questions. And don't go with the idea that we know everything. There are a lot many things which we don't know, and so
Dhiren, I would emphasize that the youngsters must know that we all started off with very little knowledge, virtually no knowledge, and we built on that. So if at this point, you don't know something, it's nothing to be embarrassed about. We certainly didn't know it at that point in time either. You'd agree, Freeman?
Yeah, yes. And the other thing is that knowledge is constantly expanding. And, I find myself having to try to catch up in areas where knowledge is developing very fast. So it's not a knowledge base which you get and then works for a career or a lifetime. It has to be something that keeps expanding.
Yeah. So thank you very much for that emphasis on the active learning process. Now we are going to apply this, but before that, I would like to ask a question. How many of you during your school and college days are exposed to active learning? So please, either you can chat or you can unmute yourself and answer also. It's a simple question. Just you have to answer yes or no.
Yes, we have been exposed to a bit of active learning, but predominant method is passive learning.
Okay, I think that yes, very few teachers, they try to adapt, and one of the reason is like this requires a lot of time. The advantage we have over here is that we don't have a fixed curriculum, and it's not mandatory for us to finish this topic in 6 or 7 sessions. So we can always go slow, we can discuss more, and we can understand it better. Fine. So we understand that you are not exposed to active learning, and for that, this process or the today's and the subsequent session will be something like that. We will support you in the developing the thinking process. But after a few days, your situation will be like there will be no support wheels, and you will be cycling of your own. And after the end of these sessions, not this one, but like the few sessions, you will be riding as comfortably as and with the confidently as this child. So that's our promise. But the only request is that only if you participate, then and then you will learn. You can't learn bicycling by just reading, by listening the lectures. You have to carry out a cycling, physical cycling, then only you learn. Okay, so let's try with a simple exercise. This is not related to pediatric orthopedics. That's not related to medicine. This is just to stimulate the thinking process. Okay, there are sets of questions for any given problem. We can apply these sets of questions, and they are like why this happened. Finding out the reasons for a particular problem, particular situation is a first question. The second, where is the problem? Third is when it happened. The fourth is who are the people who are affected? Who are the people who are responsible for this problem? What is the reason, or what can be done, or what is the actually affecting the person? And the last is how. Why and how, they are very important for us to understand, because how is going to tell us about the mechanism, and why is also going to tell us more about the etiology. So these are the two important questions. The next picture which I am going to show is a picture which happened in Ahmedabad last Sunday. Don't go with the idea that I want to give a disreputation to our country. This situation happens everywhere in the world. So it's not that this happens only in India. So this is what the picture is. And I want you to think on this and tell us what are the questions which are coming to your minds. You can start now, or if you want to wait for 2 minutes, we can wait, and then we will be happy to listen your questions.
How deep is the pothole?
How deep is the pit hole? Okay, good.
Was anybody injured?
Was anybody injured? Good, good. Yes.
How did it develop?
Yes, how it developed. Yes, that's very important thing. Good.
Where is it?
Where is it? Okay, right, good. Where it is, very good.
Is it really a picture of Ahmedabad? Is it authentic?
Okay, that's another important question. Is it an authentic picture or not? Okay, good. Yes.
Sir, how do we deal with this problem with this pothole?
Okay, how can we like treat, or how can we manage? Yes, that's another important thing. Yes.
Another aspect could be how to prevent such occurrences in future.
Yes, that's another important thing, and I'm really happy because like this happens every year in Ahmedabad, and not at the same place, but there are few locations which are really vulnerable for this, and the prevention is one of the important thing which we need to understand. And if we want to really avoid this thing happening, then we need to first of all understand that why it is happening, and the next is how can we prevent it. Okay, any more questions? Yeah, Freeman or Benjamin, would you like to add to the questions to this?
No. I think they've covered the questions. The only thing
Yes.
I'd say is please don't call this a pothole. This is a sinkhole. It's very different because potholes are there constantly. This is a rare phenomenon. And the only question I'm going to ask you is, was this a fairly new road built on
No,
previously
like saying-
existing hard,
Okay.
solid ground? Or was
Okay.
it sort of built up and then made into a road?
Yeah, so let me give you a background.
Can I make one comment?
Yeah, please.
Yeah, I think the one thing also that wasn't mentioned is what was the environment during which this occurred? In other words, what was the weather? What conditions might have led to this as well? It's part of the how did it develop, but the environmental conditions.
Okay, that's a very interesting thing, and I did not purposefully give that information. Actually, this happened last Sunday after heavy rain for Ahmedabad. It was a 6-inch rain in 4 hours period, which is really heavy rain for Ahmedabad. Usually we have 1 inch at the most in a day, but this was unusually heavy rain, and following that this happened. So what you said is very right, and I asked one of my civil engineer friend, and he said that when there is too much of water passing through a drainage system, some of the water seep out of the drainage pipe, leakage from the drainage pipe, and that is one of the reason that such things happen, because the sand or the filling underneath the road disperse with the flow of water, and then there is no support underneath, and that results into this problem. So yes, so these are the questions. So this was a very simple exercise, and with this exercise I stopped this presentation, and now we actually go to the topic which we are going to discuss. So I will stop this presentation, and then we will go to the main topic of cerebral palsy. Okay, so now we come to the management of cerebral palsy. Cerebral palsy is a condition, most common neuromuscular condition in a pediatric population. And after eradication of polio, this has become a most common condition where there is an onset in childhood, and that results into a lifelong physical disability. Sometimes in addition to physical, there are other impairment or the disability also. And this is true for most countries. It's not like that this is a problem of India, but almost everywhere we see or we come across this situation. So let's start with a story of a beautiful couple. This couple, Anjali, she's a fashion designer, and her husband is a IT person. They got married at the age of 28, and for the initial few years, both were very busy in their profession. Anjali was busy with the fashion designing, and Aditya was busy with his IT line. Aditya has to travel a lot. So initially, they were not actually serious about having a child. 5 years after the marriage, they decided that now we should have a child. Fortunately, Anjali became pregnant, and everything was going smoothly. They were under the close observation by obstetrician. Unfortunately, on the 28th week of pregnancy, she had a labor pain. They rushed to the hospital. The doctor said that we need to go for a cesarean section. The child was born at 28 weeks and weighing only 1500 gram, that is 1.5 kilogram. And child was immediately shifted to NICU. The child remained in NICU for 2 months. And after 2 months, the child was really having a weight of 3 kg. That's 3,000 gram, and was discharged from the hospital. When child was brought at home, the family celebrated the welcome of a newborn in the family, and the arrival was celebrated with great interest. At 5 months, the grandmother noticed that Aryaman, the boy's name was Aryaman. Aryaman is not carrying out the activities which the other child should be doing. The grandmother has seen Aditya developing, so she has some idea about like what is normal child development. She's a housewife, she's not a medical person, but her memory says that at 5 months, Aditya was doing much more than the Aryaman. So they visited a pediatrician, their nearby pediatrician, who was looking for the routine vaccination and all that. And the grandmother said that there is something wrong with Aryaman. Pediatrician gave a solace that don't worry, he is premature and naturally the development is going to be slow. So let's wait for another 2 months, and by that period, there should be adequate progress and the child will pick up and will be like a normal other child. There was no great improvement in 2 months. So now he's 7 months, and at 7 months, he was not developing like the other normal 7 months children are developing. So pediatrician referred them to a neuropediatrician. The neuropediatrician took the history, examined the child, and then neuropediatrician suggested that we should have an MRI. And MRI showed periventricular leukomalacia. you can see a white area around the ventricle. That's periventricular leukomalacia. What is the importance of this periventricular leukomalacia? If you look at from the motor cortex, the corticospinal tracts, they are passing just by the side of ventricle. And what we see in MRI as a periventricular leukomalacia, it affects the corticospinal tract or a motor tract. And that is the reason of cerebral palsy in many children, not all, but in few. So at 7 months, Aryaman was diagnosed to have cerebral palsy. We stop at this point and we will like to learn from you what variations do you see in your practice from this case. So we are going to discuss about variations, how they present to you, at what age they present to you. Is it the classical presentation or it is something different? I am pausing my presentation at this stage.
We see children with history of delayed cry, some children having history of respiratory distress, sir.
Right. Okay, so
And
that's
then
a
some-
history, but how do they present to you? Do they present at the same age at around 7 months, or they come present later, or they are seen?
Sir, some children present later than 1 year. They say that the child has not started walking yet. So parents come with that concern too.
Okay, right. So what is a usual age at which they present to you?
Usually at around walking age, when the child starts walking mostly.
Right, so they come to us at the walking age. Usually child starts walking at the age of 12 to 15 months, independent walking by 12 to 15 months. So they present to us by that age. Or do you have a neonatology department and they pick up that this child is vulnerable to have cerebral palsy and they suggest early intervention, and then child is diagnosed or suspected to have cerebral palsy early? What is your practice or what is the scenario in your city?
We usually see children coming to the pediatric orthopedic department by the earliest that we see is around 3 to 4 years, sir. Before that, the patient, the child is not actively evaluated. So
Okay.
once 3 to 4 years have finished, the child has not independently started to sit or stand. That is when the children are usually referred to the pediatric orthopedic department here.
Okay, because from where are you? Which
Sir, I am
city?
second year MCH resident in CMC Vellore, sir.
CMC Vellore. Okay, so at CMC Vellore, I think Freeman, you know CMC Vellore because you had visited CMC Vellore. So
Yes.
that's in the southern part of India. And it's a tertiary care center, and children present to CMC Vellore at around 3 to 4 years of age. Is any other? Yeah, Devendra.
Child may present that the child is not using one limb and not using the limb equally. I mean, while grasping objects, or anything. He's not moving the one limb.
Right. Okay. So another question is about the timing. The second question I would like to ask you is like, how many children are referred to you by someone else, like someone pediatric neurologist or someone else, and how many patients they come to you directly to the pediatric orthopedic department with a classical complaint of delayed walking or child not walking properly?
Majority are referral from another doctor, sir.
Right. So those who are in the, and I'm sure that most of you are in the tertiary referral center. And in that case, most of the children will be coming to you, not directly, but via reference of someone else. and they have identified, sometimes they have investigated, and they refer you the case for the treatment. So the question is it important to have early diagnosis?
Yes, it is important, but most times it may be difficult until the child reaches walking age when the milestones are delayed. That is the
That's
most
we
common.
are like differentiating the two point. Like, first of all, is it important to have early diagnosis?
Yes, it is, sir.
Yes. Okay.
Yes, sir.
How many of you say yes to this question, that it's important to have early diagnosis? Those who are live, they can, yes. Darshan Kapoor says yes. Yes,
Yes, sir,
it's important. Akash Ghosh says it's important. Saurav Sinha also says that yes, it's important. Prithvi Nathani, yes. Manjush, yes. So everyone is like agreeing on the point that it's important to have early diagnosis. Okay, good. Now I would like to understand from you that why it is important to have early diagnosis.
Sir, if
Okay,
we
before
detect,
that, before we come to that question, let's have a listen from Freeman. What is the age where the diagnosis is made in USA?
It varies a lot. I mean, I think it's probably quite similar to what we heard from the respondents, that there are a group of children who are graduates of the newborn intensive care unit who have been, the families have been very much sort of prepped to the risk of having disability. So the diagnosis gets often made early by the early intervention team who's following those children. But then we also see quite a few children arriving at that age when they're not walking or they're not walking normally. Also, the child who is 2 to 3 years old, not using the hand, or maybe 2 years old and is toe walking. I think it goes across the spectrum.
Okay, so more or less, like what you said is exactly matches with the scenario in India. So now coming to the important question, which almost everyone said that yes, we need to make an early diagnosis. So I would like to understand that why we want to have early diagnosis.
sir,
Yeah.
so that if early we can intervene, we can get early intervention produces better results than we need. Then to treat a contracture is difficult than to treat a spasticity.
Okay, right. Yes, anyone else would like to answer?
So we can improve the functioning of the child with least resources, least interventions, if seen at an earlier age.
Okay, then there is in the chat, someone has written that to prevent deformities and preserve joint function, that is one of the aim. Right. Okay. Anyone else?
So we need to alter the natural course of the CP, and we have to start all the multidisciplinary approaches for the patient, including occupational therapy, speech therapy, and also get vocational therapy for these patients at a very early age. So that is the reason we need to start early.
Yes, one more opinion.
Sir, we need to counsel the parents and get them understand the diagnosis so that they can start the physiotherapy and other therapies earlier. The more earlier the parents understand, the less chances of deformity and contracture occurring.
Okay, so basically, most of us believe that we need to have an early diagnosis. I am trying to ask you, or I want you to tell me why we really want to start early. So let's take a situation where the diagnosis is made at the age of 7 months, like the case which I described. And on the other end, we have a case which is coming to us at the age of 2 years. Does it really important? Does it will it make any difference in the outcome? That is what my question is.
Sir, I personally feel as far as the musculoskeletal system is concerned, there is not much difference between a 2-year-old and a 7-month-old. There are other systems which can be benefited from treatment if it is picked up at an earlier age.
Which systems?
Any associated seizure disorder that needs management.
Seizures management. Seizures means you are talking of the convulsion, or you are talking of the adduction of the leg.
No, sir, convulsions.
Convulsion. Okay, right. Yeah. So basically, convulsion. Anyway, parents are going to go to neurologist for the problem. That is a problem or a situation where no one would really wait. They will definitely immediately take it to the concerned expert. Then someone has mentioned that early diagnosis will help in the cardiorespiratory and the GI system. So that is also one important point we would like to know from the person who has answered that question, how that is going to make a difference. Okay, so this is going to be the first question for the homework. And the question is why it is important to make an early diagnosis, or is it important to make an early diagnosis? And if you say yes, then the next question is that why it is important to make early diagnosis. We will have a quick opinion of Benjamin first, and then Freeman about like why we are emphasizing a lot about early diagnosis.
Well, let me start off by saying that over the several years that I practiced in the same center, there hasn't been a dramatic change in the age at presentation. It's remained more or less static with maybe a little shift to the early diagnosis. By and large, I would say that 90% of children who are brought to me with cerebral palsy, the mother had one complaint: the child is not walking, or the child is not walking normally. So the emphasis of the parent is on the motor deficit, ignoring a lot of other stuff, which is disastrous. So I think we need to know that there may be a lot of other comorbidities which need to be looked at. And we actually published a paper in the Indian journal, in one of the rehabilitation journals several years ago. We just looked at a cohort of 100 children with cerebral palsy who were brought to us. 60% of them had an associated defect, none of which was detected early. For example, myopia. Here's a child sitting in school, and the teacher writes on the board, 2 + 2 is equal to, and calls up this child to answer. The child can't see what's written on the board. And because the child has physical disability, and the child doesn't answer this, what is the label given? This child is mentally retarded. And that's the worst crime that you can do for that child. The child may be brilliant. And we picked up -15 diopters myopia. So we need to be a little cautious when we practice pediatric orthopedics and deal with cerebral palsy. We have to be the point of, we're the first point of contact. And they don't know what to do. So we shouldn't focus on the orthopedic aspect directly. We need to do a complete checkup. And that's been our practice for years now. Visual defects, speech defects, hearing defects, which are not picked up. And as you said very rightly, if there is epilepsy, they all go to the neurologist. That isn't a problem because it's so overt. But many of the other things are very subtle and covert that they don't pay attention to. I think blindness combined with physical disability is terrible. And if you don't detect it, that's what's going to happen. So I think they need to be aware of that. The second thing that I would like to say is we all need to know that the development of the neurological system of the brain and the nervous system is there's organogenesis, which is intra-utero. Then there's establishment of connections between each of these parts of the brain. And that's the second part. And the third and most important part, which is the myelination, which proceeds well into the postnatal life, is what is responsible for acquiring motor and sensory milestones. Right? So you must remember that occurs irrespective of what we do, because if the milestones are going to develop, they will develop. If they're not going to develop, they won't develop. So then the question comes, what's the purpose of early intervention? Right? Because it is predetermined what the myelination, how it's going to proceed, you have no control over. But what is important to realize is the faculties that are not damaged by your insult, whatever it is, hypoxia or whatever, can be optimized and improved so that the child does better. And once the child gets into a regimen of stimulation and therapy, the child is likely to do better than if you leave them alone. However, having said that, we have encountered children who come in adolescence for the first time. And after intervention in terms of major surgery, many of them have done remarkably well, surprisingly. So we need to step back and think, what gains are we making? Are we really making some gains? So if you have somebody saying, I did this and the child walked, the child might have walked anywhere. We need to be a little cautious about the claims that we make for some intervention or some treatment. Freeman, do you agree with some of those controversial things that I said?
Yes, no, I completely agree. I don't think there's any area that I would disagree. And I think especially having the whole child concept of thinking about the other systems. Many children with cerebral palsy are small, so asking whether they're small because they're not feeding well, so getting nutritional assessments. I would like to emphasize this concept on early intervention that I think is a good question, because it's not all that clear how beneficial early intervention is from a motor perspective. But there's a fair bit of data, and I'll be interested to hear as people look at different literature as they do a search on the efficacy of early intervention. I mean, I'm not saying this because I'm denigrating early intervention. I'm just saying that it, from the standpoint of physical development, it's a little less than absolutely clear, at least in my mind. I do think one of the things we haven't mentioned, which we see here in this country, especially, is survivors of the newborn intensive care unit almost all go automatically into early intervention, sort of as a prevention. And sometimes this very early diagnosis can have negative consequences, because as we showed on the MRI of the case presented, there's periventricular leukomalacia, but that is not like you going to the emergency room and seeing a fractured tibia, and you can tell the patient, oh, your leg is broken, and you're going to need some treatment to make that broken leg heal. Periventricular leukomalacia is associated statistically with development of cerebral palsy, but it is not a definitive diagnosis. And sometimes parents have a hard time understanding statistical association from a sort of definitive diagnosis. And I struggle a lot with parents who come having heard this diagnosis that they had periventricular leukomalacia, and the neonatologist told them this, has a relationship to development of cerebral palsy. So they come with the automatic assumption, and they want to know, what will my child be like? That 7-month-old, I'm sure those parents were asking, well, what does this mean? Will my child walk? What will they do? What can we expect when they're in high school? Those are sort of hard questions to answer because we can't answer them. We don't know.
Okay, so the most important question, which I would like one of the fellow to take over and answer in the next session. So this is the homework, first homework. What is the evidence about or for the early intervention? Do we have any evidence? If there is a evidence, then we will think about what is the mechanism by which early intervention is helping. There is a lot of literature about neuroplasticity. So I want one of you to make a search on this, try to read literature on early intervention for cerebral palsy, and particularly, does it really making any difference in the GMFCS level of a child? That is what I want one of you to. I want one of you to take. So I request you to take this homework. Who would like to take that?
We will.
Okay, so Devendra, you are taking the responsibility of deciding or searching on a question, the importance of early intervention in cerebral palsy. Okay, good. Say yes with confidence.
Yes, sir.
Okay, thank you. Right, so let's move further. Okay, can you see my presentation?
Yes.
Yes. Okay. So let's move further. Now we have seen the first thing. Now we go to the second point. Now this is a different question, and this is about your future. How many of you want to be a successful doctor? Either say yes or write down yes.
All of us, sir. Happy and
don't reply on behalf of others. Let your colleagues, let your friend decide whether they want to become successful or not.
Yes, sir. I would like to become a happy and successful doctor.
Okay, both are different. Happy and successful are different, but we are talking of successful.
Yes,
okay.
Sir.
Yes, Dr. Bhagat, I shall like to know from you, if you want to be successful, how you are going to be successful as a doctor. So tell me the skills which you are looking forward for developing in your case. So what skill do you need for becoming successful? Yes, Dr. Bhagat, you can start with that.
I should have sound knowledge of literature, sir.
Okay, sound knowledge of literature, very good.
And should have practical knowledge also, sir. I have done the case. And should think from the patient point of view, sir. Should take care of the patients.
Right. Okay, anyone else? Because everyone said that they would like to be successful. So what are the skills you are looking for? The 3 skills Dr. Bhagat said is true. Like you need to have a good sound knowledge. You need to have a practical knowledge. You need to understand the patient's point of view. Good. What else? Bharti Ankleshwar has said yes. Varun Garg has said yes. So Varun, can you tell me which skill you need? See, this is very important that if you want to be successful, then you need to know how to be successful. then and then you will be able to do something to develop that skill. So we want to understand which skill are important from your perspective.
So first, we should know what is wrong with the patient, what is wrong happening with the patient, what is normal,
Right.
what is abnormal, and what are the various why it is happening with the patient. And then is how are we going to manage it, and what will be the future complications or implications of the intervention or treatment.
Varun, the question is slightly different. What you said is like you said about the points. I am looking for the skill, like the skill of communication, the skill of presentation, the skill, surgical skill, the thinking skill. So these are the different skill. Analyzing is another skill. So what skill are important for us?
So communication is very important, sir, apart from knowledge.
Okay, so communication is very important. Good. Anything
Good
else?
clinical skill.
Good clinical skill, right? Then?
Sir, I think decision making.
Decision making, yes. Then I strongly suggest you to read the 3 books by Benjamin, because they all are on decision making. Okay, let's move further. There are many skills which are important, but the one skill which is I consider very important is empathy. And what is empathy is basically it's an ability to put ourselves into the shoes of our patient. That's what I understand by empathy. 2 similar words, and many people, they are confused between this empathy and sympathy. I will give you one example, and by that I will try to make you understand the difference between the two. The empathy is to understand someone's problem or a pain is empathy, and sympathy is to feel that pain or suffer from that pain is called sympathy. Let me give you example so that you understand. Let's take you are working in ICU. There is one serious patient. You tried very hard to save that patient, but unfortunately you could not save that patient. The family members, when you declare that the patient is dead, they start crying. Empathy means you understand the pain of the family members is empathy. But after that, you go home and you don't eat because of the pain of the family members. That's sympathy. So one is understanding, and the second is sympathy. Before we go to the exercise, I like our expert to comment on importance of empathy in our practice. Yeah, Freeman first and then Benjamin.
Yes, I think this is for me, this has always been a bit of a struggle. So to have empathy is, I think, extremely important for a physician. But for patients that you see long-term, and when things go badly, it's very hard not to have some sympathy with the patients, because they sort of, with the families or the patients. And I think the awareness of this difference and the fact that there is some overlap is still okay. I think it's just important that you can manage. And, an example, at least, with after a whole career, if you deal with severely disabled children, things will not always go well. And one of the things that happened not often in my career, but a number of times, is a patient who dies in the operating room during surgery. It's very difficult to go and tell the family what happened. And then, 30 minutes later, when the room is turned over, to go see the next family. And put away the concern or the sympathy part of that equation, because I think the empathy is clearly there, but there is always some overlap, and one has to be aware of it and able to control it, or you can't be an effective physician for the next patient.
Okay, good. Benjamin, what is your opinion? Like, is it important skill, or do we need to develop that skill? Probably you have not unmuted yourself, sir.
Sorry about that. Yeah, I'm not sure whether you can learn how to empathize with your patients and their family. I think it's an innate quality. It's either you have it or you don't have it. And that's what I think, because I don't think I ever tried to learn empathy. It's something that sort of creeps onto you if you're sensitive enough. And as I agree with exactly with everything that Freeman says, and I would say that you do need to empathize. You do need to sympathize, but you need to control that to the extent that it doesn't impede your judgment in the next case, as Freeman said. Yeah.
Okay, good. So we are going to do the next exercise. We saw that 7-month-old child, Aryaman, who is diagnosed with periventricular leukomalacia, and the neuropediatrician said that Aryaman is going to be cerebral palsy. Now, I want you to put yourself into the shoes of family member. You are not now a doctor, you are a family member. And what questions can arise in your mind as a family member? So we are going to take a pause for 2 minutes, 3 minutes, and I want you to think about the different questions which as a family member will think at this particular point, and we will continue our discussion after 2 minutes. Yeah, so please think and make a list of questions.
Is the child going to grow up normally?
Just wait for 2 minutes, because not everyone may not be as quick as you. So it's not only one question. There may be multiple questions which arise in their mind, and think about as many questions as possible. One more minute to go.
Will he be able to walk?
There's just 1 minute to go. Let's other friends think. Okay, yeah, you can tell about the questions which family member can have.
Will my child be normal like other children?
Okay, will my child be normal like other children? Good. Next.
Will he be able to walk like the other kids?
Okay, will he be able to walk? Okay, good, good.
play or go to school and mingle with his peers.
Okay, good. So whether he will be able to go to school and play with other children, good.
Is there any treatment for the
Okay,
brain
what is
injury?
a treatment, or is there any treatment? Is there any
Is there
treatment
any
for
treatment for
periventricular
the
leukomalacia? Good.
leukomalacia?
Yes, yeah.
Whether this condition is progressive or not.
Okay, very important question, whether this condition is progressive or not.
Sir, whether the child will have a normal IQ in the future or not.
Okay, so you are now talking about not the motor activity, but you are talking about the IQ. Yes, good. Then
Why and how did this happen?
yes, a very important thing, that why this happened and how this happened. Okay, very good. Very good.
Will he be self-dependent?
Okay, will he be independent in activity of daily living? A very good question. Yes.
How much money should I plan for his treatment, or should I make any financial arrangements?
Okay, that's a very important question. They don't ask us upfront, but this is a question which is going in their mind. That's a very important question. I'm very happy that you brought this important point in the discussion.
What are the chances that the next child will have the same problem?
Okay, Varun, that's another important question, and we are going to focus on that. What, like say, one child is cerebral palsy. What are the chances of having a second child also a cerebral palsy? Good. I am very happy that you are all thinking very, very dynamically.
Sir, is there any permanent solution for this problem?
Okay, is there any permanent solution or not? Very good. Yes.
Will it recur again once treated?
Okay, so like, will it recur again? Something like what we have pneumonia or tuberculosis, like once it's cured, whether it will occur again or not. That is the question.
What is the life expectancy?
What is the life expectancy? Yes. The problem has yet just started, but still you are thinking, or like the parents may be thinking about the long-term thing also.
Where should I take my child so that he gets the best treatment?
Okay, which center will be the best center for the treatment? Very good. I would like to have an opinion of Dr. Benjamin, because like you have interacted with so many family, and I have seen that your rapport with the patient's family member is really good. So what actually they are thinking at this particular point?
Many of them have got very serious doubts, and understandable. But I tell them upfront, as mildly and as gently as possible, I'm sorry that your child has this. Cerebral palsy is a condition for which there is no complete cure. And I think the sooner they understand that and accept that, it's better, because otherwise they hang on to threads of hope, which is sometimes unrealistic. So I tell them upfront, this condition can't be cured, but we hope we can improve the status of the child in some way or the other. And we will try to tell you as time goes on what we would possibly do. So they are willing to accept that. I also tell them that you've noticed that there's a delay in milestones, which many of them do notice, particularly not walking. And I tell them that the ability to walk is not a consequence of our treatment. Because don't think that if I do an operation, it will make the child walk. The child is not walking. The intervention will not be to hasten or accelerate the acquisition of motor skills or acquisition of a milestone. That is not under our control. But we can prevent complications. We can modify the growth patterns, we can prevent deformities and correct deformities. So I try to tell them completely about it. And the second thing that I tell them is, one of the simple bits of physiotherapy that you can do even without a physiotherapist is passive stretching exercises to prevent contractions. And I emphasize right in the beginning that this must mandatorily continue till the growth is complete. In other words, till skeletal maturity. Because most often when you ask them if they have encountered other doctors, they tell us, well, he didn't tell me or she didn't tell me that I need to do this. So exactly as what somebody asked about the commitment to cost and other things, you need to tell them that there is a tremendous amount of time that they need to put into looking after the child, be it physiotherapy or be it speech stimulation, whatever they have to do, that there is an input from the parents which is extremely valuable and extremely expensive in terms of time and money. So they need to know upfront that these things are going to happen.
Okay, good. But coming to the questions which family member have on day one or during the subsequent visit, whether all the questions are covered by our fellows or still there are few questions which they have not covered.
I don't
They
know.
have covered about the long-term outcome. They have come about the longevity. They have discussed about the financial part. They have covered about the importance of treatment. They have discussed about, or they were asked about the where to go, whether we will be able to give 100% cure or not, whether they will be a complete cure or not. So almost everything they have asked. Just I would like to ask Freeman, like whether your patients, they are compared to India, probably they are more educated and more access to information. So how do they respond to such diagnosis?
Yes, it's a very difficult question because I think the other thing is that for the family, it's often a process, and the families at like this 7-month-old are coming. Fundamentally, it sounds like with the question, you know, is there something wrong with my child? Because the grandmother brought up the fact that she thinks something's wrong. And then it's coming to the realization that their child may not be normal, but still at 7 months of age, depending on the child's presentation, motor skills, and some other things, it may be extremely difficult to give any prognosis. And this uncertainty can be very difficult for family members, and they often will be wanting to latch on to somebody giving a definitive answer. So it's the question that they sort of want to know, which are all the questions that have been raised, but they want to know them definitively now. And that is part of the real difficulty, and the difficulty in dealing with this at this age. As the child gets older, it becomes more definitively clear. So by the time the child is 2, depending on how the child is doing, you can be a bit more definitive. By the time the child is 5, it's becoming quite clear where things are going, and what you can sort of discuss more realistically what the family can expect. But it's very hard for families to understand this question of, well, when will I know? How can I know? And not wanting to sort of latch on to somebody who gives a definitive answer and then be later disappointed when that definitive answer doesn't come true. And I must say that I have seen cases in which it can go both ways. People get very angry when they are told that the child is probably going to do well, but then makes very little progress. They will feel very disappointed, or like the physicians weren't honest. But equally, many people are happy when the opposite happens. But I have had a number of patients who become very immobilized by the concept when they're told, no, your child is going to have cerebral palsy and they're likely going to not walk, and giving all these dire diagnoses. And when the child's 8 years old, they're walking, running around and looking essentially normal. And the family is still waiting. When is this going to happen? When is this going to happen? And it's very hard to convince some families that it isn't going to happen. And again, they
I think there is some problem with the connection. Okay, let's move further. Hello. Hello.
Yeah, we can hear you, sir.
Okay, fine. So basically, in that case, there is some problem with Freeman's internet. Fine, let's move on to the third point. And the third point is a slightly different point. Let's take a hypothetical situation. And in this hypothetical situation, the Prime Minister Narendra Modi asks your head of the department and says that we want to eradicate cerebral palsy from our country. We have heard the word eradication of polio a lot. Based on that, the Prime Minister wants to eradicate cerebral palsy from our country. So first of all, I want you to understand the difference between the eradication of polio and cerebral palsy. Is it a similar mechanism or it is a different mechanism? That is what I want you to think. If you are ready with the answer, you can answer the question also.
It's a different mechanism, sir.
It's a different mechanism. What is the difference? Both are neuromuscular condition. Then why can't we treat or eradicate in a similar way?
Polio has a specific pathological cause, an organism which can be targeted at.
Okay.
Whereas CP is a host of problems ranging from the antenatal to the perinatal period.
Okay, right.
After improving antenatal conditions, the CP CP incidence decreases, but it's not completely eradicated. It's not eradicatable.
Okay, so you believe that at this stage it's not possible to eradicate cerebral palsy?
No, it's
right?
not.
Yeah. So the next question is, the Prime Minister says that fine, we can't eradicate, then definitely we want to reduce the incidence of cerebral palsy, because that's put a lot of load on the government scheme, and we have to spend a lot of money on cerebral palsy children. So in that case, the next question is, how will you proceed to give a suggestion to Prime Minister about reducing the incidence of cerebral palsy in our country? So we are just thinking about the process first, and after that I will give homework to you. So the question is about, if we want to reduce the incidence of cerebral palsy, how can we do that in our country? Yes, if anyone is ready, then you can answer. Okay, the answer is by Dr. Khatri, by improving perinatal care service. Okay, then Ankit Jain has answered various pre, peri, postnatal causes. Yeah, Vikas, what do you think?
Make hospital deliveries compulsory, sir.
Make hospital delivery compulsory, right? Okay, so now the next homework, the first homework is taken by Devendra and team. So someone else has to take this homework, that if we want to reduce the incidence of cerebral palsy in India, how should we proceed? So for that, we need to have understanding about what are the causes which are likely to cause cerebral palsy. There is a big difference between polio and cerebral palsy. Polio is by one virus, and if we can take care of that virus, then definitely we can reduce the incidence of polio. While cerebral palsy is a multifactorial condition, many different conditions, they ultimately result into cerebral palsy. So we need to look for the cause or causes. We need to understand that how does it affect brain, because once we understand that, then probably we can do something to modify it. So we need to find out or understand the causes. We need to understand that how that particular cause affect the brain. Let's take an example. Hypoxia leads to brain damage. So the next question will be, how can or how does hypoxia affect the brain or insult the brain? The next point is why this factor hypoxia occur. That will be the third question. I'm giving hypoxia for better understanding. We need to think about hypoglycemia. We need to think about prematurity. We need to think of all the causes. How does it affect brain? And the last is, how can we reduce the incidence of that cause? So how can we prevent it? So who will take this homework? Yes, who will like to take this homework? Dr. Khatri and Dr. Akash from Chandigarh, would you like to take this lead?
Yes, sir.
Yes, sir. So you understood the question, and you have to come out with suggestions. And next time you have to present those suggestions to the group.
Okay, sir.
And how many minutes shall I spare? Or you can tell me one day before that how many minutes you want, so that I can plan the session accordingly.
We'll do that, sir.
Okay, right. So at this stage, we stop our discussion. And now I want you to comment about the teaching process. And at the same point, what are you looking from these sessions down the line, so that we can plan the sessions accordingly. Yeah, please come out with your suggestions, your feedback, which is very important for us.
It was really helpful, sir. It's not monotonous. Interaction is really better. 1.5 hours really well spent. We learned something.
Okay, thank you, Vikas. What more you want to learn in the future course?
Subsequently, proper clinical diagnosis and decision making.
Okay, that definitely we will come to that point. But please, I would like to clarify at this stage that cerebral palsy is a very important condition where surgery is important, but more important is to tackle the family psychology is very important. So that is why I am covering different aspect related to cerebral palsy management rather than jumping straightway to the surgical treatment, because this is very different than a fracture where you really need a good surgical skill. But to understand this condition, we need to have a good social skill also. And that is why we are covering this aspect. Freeman is here, and Freeman, we would like to hear from you, and I would like to ask you a question. the book which you have written for the family member, at what stage do you recommend that book? We can't hear you, Freeman.
Okay, can you hear me?
Yes, yes.
Okay. Now I'm getting feedback.
Yes, now
Sorry.
it is okay.
Okay. The book is organized so that by ages and severity. So we usually recommend the book when we have the first diagnosis or when families first come to us. And it's sort of organized almost in an encyclopedia level, so that if we tell the family of a 2-year-old, it looks like your child has hemiplegia, then the family can go to the section in the book of 2-year-olds with hemiplegia. Because the other problem with cerebral palsy is there's such a diversity of presentations that in many ways, what is useful for one family is not useful for another family.
Okay, I would also like to ask in the remaining few minutes, we have 4 minutes to before we end the session. Benjamin, what do you think? Like, should we come out with a similar type of book for India where our family member can understand and which can be useful to them? What do you think?
It would be lovely, but unfortunately, you'd have to produce it in different languages because you need to have it in the local vernacular. I don't think an English book is going to serve that purpose. So yes, it would be great if someone can do that and get it translated. Now, I was very happy that one of my former patients, who is a local boy who comes from a place very close by, he's now a young man in IT, and he decided with his friends that he wants to write a chapter, a small book on cerebral palsy, and asked me to contribute to it. Now, he's writing it in the vernacular. And I don't write I can't write the local language. So I wrote it in English and got a Kannada teacher who is very good to translate it. And he's writing a book on it. So he's covering quite a lot of interesting things. And I quite like that. So if we can stimulate some local interest, I'm sure you can get something done.
Yeah, because translating is now not that big a problem. We can start with a Google Translate and then we can modify that.
I'm not sure, because some of these technical stuff, it's better that you go through somebody who can understand.
Yeah, professional would always be a very good alternative or option.
Yeah.
Yes, but like looking to 20 languages in India or even more, it's difficult to have a book in every language. So, but yes, I think that can be of a good help to our family members. So we really need to think about that also in the future. So with that, once again, I thank our participants and the 2 experts, Freeman and Benjamin, for sharing their knowledge with us. And in future session, that is going to be on the 26th of July, the same time, 5 to 6:30, we will continue the discussion forward. I know that this time is a bit odd for you, but to accommodate Freeman Miller, we have selected a time where he is relatively free and he can participate in this session. So please bear with us about the timing part. But I'm sure that whatever you will learn, that is going to be of great help in the future. If you have any questions, any suggestions, please feel free to ask me. My email is Ganjwala, GANJWALA @gmail.com. I would be happy to receive your feedback and suggestions for the future session. So with that, we end our session. Thank you once again.
Thank you.
Thank you.
Thank you.
Thank you, sir.
Thank you.
Answer 26. Answer. These any sir. अच्छा sorry sir. June है sir.